Let me introduce our second speaker, because Ambassador John Lange has a similarly very distinguished diplomatic history. And John was heading the U.S. delegation for much of the negotiations during the PIP. But Ambassador Lange has a 28-year career in the Foreign Service in the State Department. And he served as the ambassador in Botswana. He led the U.S. Embassy in Tanzania. He has had tours of duties in Geneva, in Rome, in Paris, and in Mexico City. And he is the author of a case study on pandemic influenza. John is currently the Senior Fellow for Global Health Diplomacy at the UN Foundation, and he serves as the organization's primary focal point for global health diplomacy activities. And he has a lot of contact with the World Health Organization. And then Ambassador Lange was previously at the Bill and Melinda Gates Foundation, where he similarly engaged in high-level global health advocacy with international organizations. So John, can I turn to you?
Thank you very much, KG, and thanks to you and Peter for putting this together. Ambassador Wibisono gave you the Indonesian context for this eventual development of the pandemic influenza preparedness framework. I'll talk initially about the U.S. context. There was a lot of discussion earlier today about the importance of having high-level political engagement and how that is sometimes difficult. Well, in this case, it was not difficult because President George W. Bush read John Barry's book, The Great Influenza, about the 1918-1919 pandemic and got very engaged on this. And Bruce Gellin, whom we heard from earlier, can tell you how Secretary of Health and Human Services Mike Leavitt sent an annotated version of that book to every member of Congress. The State Department had the lead on the international engagement for pandemic preparedness, and at one point I went to a meeting in the cabinet room of the White House that was chaired by the National Security Advisor, Homeland Security Advisor, it was called then, Fran Townsend, with the Secretary of Health and Human Services on my right and the Secretary of Homeland Security on my left. And the reason I was there was that the Secretary of State and the Undersecretary of State were unavailable at that time. This was the highest level of engagement that you can imagine in the U.S. government. President Bush in September 2005 announced the International Partnership for Avian and Pandemic Influenza, which we called IPAPI. I was chairing weekly coordination meetings. Dennis Carroll, Bruce Gellin, and others were part of these many discussions. And in that context, when in December 2006, Minister Supari, the Indonesian health minister, said she would refuse to share viruses, you can imagine the great concern at the top levels of the United States government. We're all worried about this H5N1 virus potentially causing a catastrophic pandemic influenza, and suddenly the viruses would no longer be shared. The U.S. government view at the time was very clear. The Global Influenza Surveillance Network had been working since 1952. Time matters, as we heard earlier today. We needed that immediate sharing of samples because every day, every week saves lives when you have a pandemic coming about, and you have to have that those virus samples in possession of WHO collaborating centers, such as the Centers for Disease Control and Prevention, and then eventually to the vaccine manufacturers if you can produce a vaccine for this. So we were very consistent about that, and it's the idea that there should be prior informed consent, which was one of the Indonesian arguments, we felt would bring in delays. The Director General of WHO, Margaret Chan, in a side meeting on the international health regulations in May of 2007, said, quote, "You are tying my hands, muffling my ears, and blinding my eyes," unquote, by not sharing virus samples. So it was in that context that we were looking at it from a U.S. government standpoint as a public health issue, not as an equity issue. And as a public health issue, you want to have that immediate sharing of the viruses. In May of 2007, the World Health Organization at the World Health Assembly passed a resolution. It was hours and hours of debate, and the resolution was to create a process for more discussions, which ended up taking 4 years. As we proceeded on this, there were times when we went into these broad-based discussions called the intergovernmental meeting, but we also had some one-on-one or bilateral discussions, the Indonesian government and the U.S. government, and sometimes they were facilitated by Australia because Jane Halton, a very prominent person, the top civil service person in the Australian Ministry of Health, was chairing this intergovernmental meeting. I have your minister's book here. It's Time for the World to Change in the Spirit of Dignity, Equity, and Transparency by Dr. Supari. And she ends up describing the negotiations that we had in November 2007 at the Palais des Nations, the United Nations office in Geneva. She went on for about 4 pages about what we discussed, and then she concludes, "It was the most violent argument I ever had." Now, I thought it was a frank and candid exchange of views, but she termed it differently. And she does say in there, eventually the meeting ended and we agreed on only one thing, that we did not have the same perception. And I think that was what was really going on here, was you were talking about equity and access to the fruits of these virus samples, meaning the vaccine, and we were talking about public health and the need to immediately have these virus samples shared so vaccines could be prepared for the benefit of the world. But at the same time, as Bruce Gellin talked about earlier, there was that, you always knew in the back of your mind, even though we never said it explicitly, there was that tension between once the vaccine was ready to use for domestic purposes or for helping developing countries. In August of 2008, actually, Ambassador Richard Holbrooke, who was one of the very prominent U.S. ambassadors, and Laurie Garrett, who spoke to the National Academies yesterday, did an op-ed piece, and they were very critical of this, the Indonesian argument. And I'll quote a bit. "Here's a concept you've probably never heard of, viral sovereignty. This extremely dangerous idea comes to us courtesy of Indonesia's Minister of Health, who asserts that deadly viruses are the sovereign property of individual nations, even though they cross borders and could pose a pandemic threat to all the peoples of the world." Then, in response, Ambassador Wibisono wrote in the Jakarta Post disagreeing with their assessment and pointing out the Convention on Biological Diversity. It was really difficult in these first couple of years of negotiations, and I ended up retiring from the Foreign Service of the State Department in 2009. But the negotiations went on for 2 more years, and that was really, in many respects, they came to a successful conclusion because of the 2 people who were driving it. By then, this intergovernmental meeting was co-chaired by the Mexican and Norwegian ambassadors in Geneva. And finally then, at the World Health Assembly in May of 2011, the World Health Assembly Resolution 64.5 was passed, and that's where we came up with the Pandemic Influenza Preparedness Framework that we'll hear more about from Steve and Ann.
Thanks, John.